Healthcare websites are failing patients with disabilities, and it's creating serious privacy risks. When blind users can't navigate patient portals, they're forced to ask family members for help accessing personal medical information, instantly compromising their privacy. Patient portals must balance two crucial requirements: HIPAA privacy rules and accessibility standards. When done right, they actually support each other. Screen reader compatibility lets vision-impaired patients access information privately, while keyboard navigation helps those with motor disabilities complete forms independently. The legal stakes are high. Healthcare sites must comply with HIPAA, ADA, Section 508, and the Affordable Care Act. Failing to meet these standards can lead to lawsuits, loss of federal funding, and damaged reputation. Critical accessibility features include accessible login systems with alternatives to visual CAPTCHAs, multiple authentication options beyond just fingerprints or facial recognition, and properly formatted medical documents with text descriptions for images and test results. Lab results need well-structured tables with clear headings and normal ranges, while prescription information should use plain language for medication instructions and side effects. Beyond legal requirements, accessible healthcare websites expand patient reach, reduce support costs, improve user experience for everyone, and enhance brand reputation. Making digital healthcare accessible isn't just about compliance. It's about providing quality care that truly serves all patients.